Welcome to Kaleida Health Medically Speaking and our special series on the fight against the coronavirus. As you can see, we have modified our format to practice safe social distancing while providing timely and factual updates from the Kaleida Health team during this public health crisis. We as a healthcare organization believe it's important for the Western New York community to hear from our medical experts who are leading the charge in our facilities and with our workforce of over 10,000 strong. I'm Mike Hughes, and this is Medically Speaking. Welcome, John Strait.
Thanks, Mike, for having me.
So I want to talk a little bit about corporate security and some of the things that are going on, in particular where your oversight is at Suburban and DeGraff, but overall for Kaleida Health as an organization. So if you can, tell us a little bit about what the Kaleida Health security team is responsible for on a day-to-day basis.
Well, the first thing is that we want to make sure we provide a safe and secure environment for everyone. That, of course, will be our employees, our patients, and their loved ones as well. And we do so by providing our access control. They'll come in and we'll make sure that the patient's listed on the person that requests them. We'll give them a badge pass through our green security system that allows them to go up and see their loved one. And, normally we would be making interior, exterior patrols, again, checking the campus, making sure that we're protecting Kaleida Health's assets while also providing a safe and secure environment.
So you mentioned visitation and people coming in to see their loved ones. What's changed over the last five to 10 years in terms of patient privacy and visitor restrictions and security?
Well, definitely the last 5 to 10 years, we've been able to focus a little bit more with the technology. Just by us being able to research with regards to that patient being here. And again, we're all HIPAA trained, but anybody coming in, we want to make sure that they are here for that actual patient, just not walking around and trying to figure out other opportunities when they are coming onto our campuses. There's a check and balance of how we're doing that. Sometimes we have restrictions in place for certain people, and that, with that in place, we're able to easily identify those individuals.
So if you take the current pandemic that's going on, the current public health crisis, obviously, it's a very serious concern in our community. But what I think has been overlooked, and it's one of the reasons why we want to talk to you today, is how the security team really is on the front line and the first line of defense for this. I know there's a lot of focus in on the clinical staff and those who are dealing with patients, but you and your team are on the front line dealing with people as they come through the door. Tell us a little bit about that.
Well, as this kind of has started to evolve, and it's been a daily, ongoing, pretty much escalation to our strategic planning. What we've been doing is we started the initial screening process at all our entry points, making sure that those coming in, if they were traveling or if they were sick or any loved ones were sick, we were already starting to do that pretty much from day one. And with that in mind, we then started to utilize our team with the proper PPE, making sure that as we're talking to these individuals coming in, and that became also with our employees. As they came in, we were doing the same with them. So it was escalating, our plan was escalating, and communication really was flawless to make sure that we were getting that message delivered to us from our director, Joe Cioli, as he got the information from the exec team or the command center from Kaleida Health. So with regards to trying to make sure that it was a safe environment from everybody coming in, I think we really got involved with this really quickly with regards to trying to keep everybody protected.
So if you look across the organization, the various hospitals and nursing homes, really we focus the entry points to very few. So the access is restricted. There's screenings that are going on in terms of checking temperature and travel history and things like that. So can you tell us how you guys are interfacing with the clinical teams as part of that restricted access?
Yeah, and it's been going, in my opinion, great. The screening teams and the employees and us really are working together to make sure that those two entry points, for out here are going and moving along as best as they can. Everybody coming in at both entry points are being, like you said, temperature screening And the visitors and the patients, of course, they're being asked certain questions as well. We're getting and providing the masks as, to everybody that's walking in. It's a mandate. Everybody has to wear it, no matter where they are. There's no, option with regards to making sure that they got that mask on now.
So in terms of restricting visitors for people who might be inpatients or for someone who may be having a baby, we've really limited access, but that's really designed to help protect the workforce and our current patients. If you can explain to us why you guys did that.
Well, again, with regards to, we wanted to make sure social distancing is being practiced, and we want to make sure that pertains as well to that patient of ours. We have not just one patient coming in that door with one visitor. We have a whole hospital full of our patients, and we have to look out for everybody that's here, in addition to the staff that are taking care of them. That's why a restriction on the visitation, that social distancing, stay home, I think is really why we wanted to get a jump on making sure that if there's an opportunity for this to kind of plateau, that's the best way that we could have done it with our organization. As you know, I've been around almost 40 years. And I got to say, I've seen a lot in my career, but the one thing that's always been a constant is that Kaleida Health has never disappointed me as far as how they've responded to any kind of an emergency. This being just another one, I think they're responding well from leadership, and they're dealing with it really from a calm perspective that our employees need to see that. Because if they see us not being calm, dealing with this situation, they're going to act a lot differently than what they are now.
That's great. Well, John, thanks for your help, your teammates' help, in keeping our staff safe and healthy during this crisis. We appreciate all that you do for not only the workforce, but for the patients that we take care of. So thanks again.
All right. Thank you, Mike.